we have communicated with the Commission that they should come up with a proposal to tackle the issue of illegal practices with cooperation between the police services, the customs services and the legal systems, because we are not able, with the piece of legislation that came up recently with this directive, which is dealing mainly with legal chain, with pharmacies, to tackle issues and deal with illegal chain of distribution.
The EU has established effective regulatory regimes for civil aviation, for food safety, for maritime safety, but patient safety has yet to be properly addressed by this Parliament. The political system in Europe is accountable to the citizens of Europe for patient safety and public protection. There are consequences for citizens and patients when regulation fails. We all have had the experience of the disasters associated with the financial regulatory system, and we should learn the lessons from that crisis.
Patients are the most vulnerable of consumers, and this is a consumer issue if there isn't information that's following. So our belief is that the standards, the guidance and help for patients should be freely available via websites and on request. And I think information is an area where there is really an opportunity now to have a serious engagement across Europe about the use of information and the freedom of information. If you have free movement of labour, in our view, you need to have free movement of information as well.
In some countries there are legal online pharmacies. For example, in Germany, consumers can identify legal online pharmacies with a logo that they can click on, and then they're addressed to the Ministry of Health, and then they can verify the authenticity of the website. There can be a register for legal online pharmacies that can help consumers to find those pharmacies, legal pharmacies, where it is legal.
The policy goals of the Commission on this area is to improve the citizens' health by making life-saving information available where and when needed between countries, if necessary, using safe and interoperable e-health tools. To make these e-health tools more effective, user-friendly and widely accepted by involving professionals and patients in strategy, we need to work in design and implementation.
Illegal internet pharmacies, these are by far the major source of counterfeit medicines, threatening those patients that seek cheaper, stigmatized or unauthorized treatments. It's absolutely pointless in moving forward on e-health solutions without involving effectively the stakeholders themselves. Also, patients should be provided with quality, reliable and transparent information about the sources of internet pharmacies, and they should be able to identify very easily whether the internet pharmacy is accredited and is part of a public database of legally approved internet pharmacies.
The success factors underpinning the safety of the model that we have chosen and implemented for Ireland is that we have a national standardised implementation framework underpinned by legislation and very robust regulation. We have evidence-based standards for nurse prescribing practice that are nationally adapted. Every organisation must have a formal approved nurse prescribing policy. It has provided us with impetus to establish or re-establish Drugs and Therapeutics Committee. Each nurse prescriber's practice is monitored and audited quarterly for their first year in practice and biannually thereafter.
The particular area that I have an interest in is in the sharing of information between regulatory bodies in different member states. As of now, that can happen, but in many cases it doesn't happen. So we have free movement of healthcare workers across member states. That's core to what the EU is about. But with free movement of healthcare workers, we also need free movement of information. And I think that then helps to contribute to patient safety. So my view is that there needs to be mandatory sharing of information between the various regulatory bodies in the member states.